Hello there, this is Dr. Meleca here. I wanted to send or make a video that would essentially be your guide to performing any kind of post-operative care from an ingrown toenail procedure that is done in my office. This is a very in-office type, more of a benign surgical procedure. I guess it could technically be considered surgery. I don't really even necessarily consider it surgery. This is all done under local anesthesia, and it's a very, very simple and quick procedure that is done in the office with minimal complications, although, some patients have experienced some. In any event, the postoperative care consists of exactly the following, okay? What you are going to do first and foremost is when you have your procedure performed in the office, you keep the dressing that I put on for 24 hours. After 24 hours, the next day, you can actually take a shower with the dressing on the foot or on the toe. You keep the dressing on the toe while you're in the shower because you don't want to get the area dirty with anything that you're washing off of your body, okay? So you keep the dressing on while in the shower. Immediately after your shower, okay, you are going to remove the dressing and then you are going to soak the respective foot in this exact solution, okay? Make sure everyone knows what iodine is or betadine, okay? You need to purchase this at the pharmacy, and once you purchase it at the pharmacy, you get about 30 droplets of iodine and about a gallon of clean water. And that is what you soak your foot in for about 10 to 15 minutes. After your soak is complete, you are going to redress the area. Well, you pat it all dry, and then you redress the area with exactly the same materials, or roughly the same materials that I dressed you with here in the office after I finished your procedure. One of these ingredients, quote unquote, is triple antibiotic ointment or Neosporin. Either one works. Personally, it doesn't really matter to me, okay? So this is 1, 2, a 4x4 gauze that you fold in half twice to make it like a quarter of the size that it is, like so. And then you put it on the toe with the ointment. And then you fasten it all with what's called Coban, okay? Just the way that I showed you in the office, and I demonstrate this to you in the office, okay? So if you don't have these materials, these are the materials that you will need to purchase at the pharmacy, okay? 1, iodine or betadine. 2, antibiotic ointment or Neosporin. 3, gauze. 4, Coban, okay? C-O-B-A-N, Coban. Okay, if you do not have these materials at home, you definitely need to purchase them from a pharmacy for your 2-week post-operative care. You're gonna have to bandage your respective ingrown toenail site for about a couple of weeks because it takes about a couple of weeks for that place to heal. I do highly recommend that you do not go into any salt water, lake water, river water, or even any pools or hot tubs for those few weeks, just to let the area heal and be void of any kind of bacterial contamination. And I also do recommend keeping the area clean, dry, and intact. So if you have to shower, okay, you can shower with it out if you don't want to get it wet, but if you want to do what I mentioned to you first, you can also do that as well, okay? So this is the postoperative protocol for an ingrown toenail. If you have any questions, feel free to call the office, 904-460-1120. Take care, guys.